Hi, guys. Let me introduce myself. I am Shaman. For those of you who don't know me, my channel name is Brownie Reviews. As you can see on the screen, our topic today is Kawasaki disease. This video is particularly relevant to those of you who is interested in is Kawasaki disease related to the coronavirus? So what is Kawasaki syndrome? Over the past few weeks, doctors around the world have noticed an uptick in children ill with Kawasaki disease, a rare childhood illness that causes inflammation of blood vessels. So far, the number of cases has been small, but it's concerning, given that many of the children hospitalized for the disease also tested positive for the coronavirus. Neither the World Heath Organization nor the Centers for Disease Control and Prevention has verified a link between Kawasaki disease and coronavirus, but the WHO is urgently investigating the possibility, as are state officials in New York, where at least 15 children have been hospitalized with symptoms associated with the disease. Here's everything we know so far. What is Kawasaki disease? Kawasaki disease, also known as Kawasaki syndrome, is a form of vasculitis, a family of rare disorders characterized by inflammation of the body's blood vessels. According to the CDC, the clinical symptoms of Kawasaki disease include fever, rash, swelling of the hands and feet, irritation and redness of the whites of the eyes, swollen lymph glands in the neck, and irritation and inflammation of the mouth, lips, and throat. According to the National Institutes of Health, in the US and other Western countries, Kawasaki disease occurs annually in approximately 1 in 10,000 children under 5, though recent infections have included children up to age 15. According to the Mayo Clinic, Kawasaki disease is usually treatable with intravenous immunoglobulin and aspirin, and most children make a full recovery. However, if left untreated, it can lead to heart disease or other serious heart complications that can be life-threatening. Is there a link between Kawasaki disease and coronavirus? After a small but growing number of children have been hospitalized with symptoms of Kawasaki disease and have also tested positive for coronavirus, health officials are investigating the link between the two. In the UK, at least 12 children have required urgent care due to symptoms linked to the coronavirus, many of whom have been confirmed to have Kawasaki disease, which can resemble toxic shock syndrome. Health officials in Italy, Spain, Switzerland, Belgium, and France have also reported a rise in cases resembling toxic shock syndrome and Kawasaki disease. New York City has also reported a concerning rise in hospitalizations due to Kawasaki disease. According to the New York Times, at least 15 children between the ages of 2 and 15 have been hospitalized with symptoms associated with Kawasaki disease and toxic shock syndrome in the past 3 weeks. According to a bulletin from the State Health Department, none of the children have died, but most required blood pressure support, and 5 needed ventilators. Many of these patients also tested positive for COVID-19 or its antibodies, which is alarming given that children typically have milder cases of the virus. However, this isn't always the case. According to The Intercept, as of April 30, 20 children in the U.S. who tested positive for COVID-19 have died. What are health officials saying? Right now, health officials are still investigating the possible link between Kawasaki disease and COVID-19. In a news briefing last week, Dr. Adam Finn, chair of the WHO's European Technical Advisory Group, said the WHO was aware of the newly described syndrome presenting in Europe and North America, adding that they are urgently conducting a surveillance study in the United Kingdom to establish what is going on. Additionally, state officials in New York are investigating the syndrome. Even though the relationship of this syndrome to COVID-19 is not yet defined, and not all of these cases have tested positive for COVID-19 by either DNA test or serology, the clinical nature of this virus is such that we are asking all providers to contact us immediately if they see patients who meet the criteria we've outlined, New York City Health Commissioner Dr. Oxiris Barbat told The Times in a statement. On Wednesday afternoon, New York City Mayor Bill de Blasio relayed this information in an urgent health alert for parents and doctors. If your child is experiencing a persistent fever, rash, abdominal pain or vomiting, call your doctor right away, he tweeted, elaborating that the NYC Department of Health and Mental Hygiene has instructed all city health providers to immediately report any patients under 21 years of age who exhibit symptoms associated with Kawasaki disease. Is Kawasaki disease related to the coronavirus? Experts say it's too early to tell if the disease can be associated with COVID-19. We've never seen the coronavirus before, but we've been dealing with Kawasaki disease for decades, Esper said. He also said that experts aren't even sure if the mystery disease popping up in parts of Europe and the US can be definitively identified as Kawasaki disease. So far, he hasn't seen any. The reports mention coronary artery dilation, which would be a major indication. I will caution that there are many things that look similar to Kawasaki disease, Esper said. It could be that what they're calling Kawasaki is not Kawasaki but an inflammatory disease caused by the coronavirus.